Tonight at 6 o'clock at City Hall, there is a rally for the city budget to go to what Bobby Stern had proposed, that 1.5% goes towards human services. Now it's at 0.8%. And so it's just to get it up to what they're talking about even cutting it more. So that's 6 o'clock at City Hall.
I just want to say, if anybody hasn't signed the petition for Hamilton County to end gerrymandering, I have one here.
Monica Lira here. I have signs. I brought a few with me today if you want one. Stevie, thank you. They're $10 each.
If any of you live in the Blue Ash area, the Blue Ash Activist Group is meeting tomorrow night. If you'd like to come and talk to me, I'll let you know where exactly it is.
Would the people who said they have petitions that you can sign raise their hands again for a moment? One in the front, one standing up, a couple more. So the people who still need to sign petitions, recognize where those folks are and sign their petitions, because we're sort of swamped at the table back here.
Also, I have Claremont and Warren County petitions back here. And a couple people turning in petitions today had some issues. Make sure that if somebody is from a different county, they have a totally different petition. They can't just sign on a different page. It needs to be on a totally different petition. Also, there's a place on the back page where it says, if you're employed, fill this in. And if that's just for people who get paid to get, that's for Republicans who pay their people to go get petitions filled out. We do it voluntarily. Okay?
Okay, so I have a couple of announcements. The first one is this Thursday, the 22nd. There's another showing of the video for getting money out of politics, Move to Amend. And that will be in Madera. So I'll put the information down for everybody who's interested. It starts at 6:30 p.m. Also, on the 4th of July, the 22nd, this Thursday. On the 4th of July, we're having a big concert in which Peter Yarrow will be singing, along with a country singer called Richard Lynch, in his farm, which is called Keeping It Country. So if you're interested, go to betterangels.com, better/angels.org, and purchase your tickets.
Anyone else?
Did somebody already mention a march for the health care bill tomorrow from Senator Portman's office? Oh, can we turn it on or just talk closer? Talk closer. So there's a march tomorrow to demonstrate against the loss of health care for everybody because of this bill that we haven't seen yet. And we're supposed to wear black, and it will go from Senator Portman's office, meeting at 5, and go to that park, Pruitt Park. It's about 0.6 miles. And also during the day, on every hour, if we have enough people, groups of 10 will go up to his office to give their points of view. Okay, that's what I said.
In addition, tomorrow evening at Planned Parenthood, because so much of this health care that they're talking about is denying women's rights. And so at 6 o'clock tomorrow and Thursday and Friday, there are going to be gatherings at Planned Parenthood in Mount Auburn.
Just like to inform everybody that we have received from you so far 134 signatures for the redistricting petition. So thank you very much, and let's keep them coming.
Okay, sure, you know your petitions do not need to be complete in order to turn them in. Keep them coming and check out another petition so that you can keep turning in those signatures.
Anyone else? Hang on. Oh, could you repeat the Planned Parenthood information?
tomorrow, Thursday, and Friday at 6 o'clock, there will be a gathering out in front of Planned Parenthood for women's rights or women's health care, because this seems to be, if you are a woman, you have a pre-existing condition. Excuse me. Okay.
Did you say the address of Planned Parenthood?
It's in Mount Auburn, right on Auburn Avenue near Christ Hospital. Okay, now without further ado, today we have our own Dick Bozian, who is a retired UC Medical Center professor. He taught there for 25 years in nutrition. And I guess that's why he's still with us now and in such amazingly good health. I want to tell you, you're my hero. You're my hero. Yeah. I got to try and walk 5 miles every day.
And may I add real quickly that since he's turning 98 in August, we are having some little tea cookies back here to celebrate. Once everybody's finished with their meal, they can come and get one. We'll have them laid out.
Awesome. We always have to have some treats. So, since he is retired, he has been very much active in finding alternatives to AA for alcohol abuse, and now he has been very much on the platform about healthcare. And so I'm going to turn this over to him so he can, we have lots of time to spend with him.
This good?
Yeah,
No?
that's good, that's good.
Okay. Yeah. Several weeks ago, someone said that they enjoyed coming to this meeting because they never fail to learn something. I'm going to tell you, that's really, really true. It's an outstanding meeting, so I hope I can hold up to it. Yeah. I'd like to discuss healthcare and gerrymandering because it focuses on the pressing need to repeal Citizens United that confers personhood on corporations and equates money with free speech. I woke up as Kate mentioned, I've been very much involved since retirement with addiction and alternatives, AA and cognitive behavioral program. So I just woke up to the problem of health care just about a dozen years ago. And I to a degree, my late list was because I mentioned, because of involvement with the drug system. My first involvement was with the Physicians for National Health Program, and soon after with the Single Payer Action Network, which sired healthcare for all Ohioans with the goal of Medicare for all. We have to raise the question, why do the Republicans come up with the American Health Care Act, the one that the House of Representatives developed, and what the Senate? The Senate plan will surely reduce taxes for the top 2%, increase defense spending, already bloated, by 10%, decrease Medicaid spending, increase premiums for folks between 45 and 64. I mean, right across the board, it's absolutely devastating. And, you know, with my age, I have to have it. The old days I could have spoken ad lib, but I can't do it anymore. Please place folks with pre-existing conditions into a high premium group and place a cap on lifetime medical expenditure to around $1 billion, while leaving 23 million people without insurance, maybe as many as 50 billion if you count the ones that are not there now. The problem lies with what philosopher Andy Norman of Carnegie Mellon Institute describes as ideological derangement. You know ideology, but derangement is an old term for being off your buttons, losing your buttons. Ideological derangement. That's what we're dealing with when we're dealing with why we're dealing with the Republicans and what they're doing right now. But it's far less frequent and less ideological derangement occurs on the left, not just on the right. Really, when you compare left and right, we're really far, far behind them. Now, David Altman, a legal environmental specialist, recently described the techniques of the corporations very tellingly. They don't bother to repeal a law. They merely go after the agencies that lead to prosecution and punishment, and lead to exposure of it. That's how they operate. And I'll give you some examples of that. And then we'll have an opportunity to discuss things very briefly. I've already got about 8 slides that we're going to show. Yeah. A prime example, a coalition with which I was involved about 8 years ago succeeded in pursuing public financing of mayoral elections in Cincinnati. The very next year, the corporation successfully produced or financed legislation to not allow any public money to be spent for the mayoral election. In other words, the thing that was passed is on the book, but you can't pursue it. That's a beautiful technique that corporations use. A similar tactic is being used to deny essential drugs at a decent price. Our own household has experienced this at first hand. My wife has rheumatoid arthritis well controlled with the drug Plaquenil, an anti-malarial that was developed during World War II, costing 25 cents a day. In January of this year, the price went up to $2.50 a day. 25, in other words, tenfold. Now, this is a generic drug that has been on the market for 75 years. We just raised the price arbitrarily tenfold. Yeah. Donatel is an antispasmodic for gastric upset and gastric reflux. We used to go for pennies. It's up to $10 a day. In order for you to get Donatel today, it's $10 a day. They obviously know that you're not going to be able to get it, and you'll probably have to go to some other drug that is somewhere in between. A second generation penicillin antibiotic has gone from 15 cents a day to $6 a day. We had that experience just very recently. That's a typical technique that's being used. I will just show some 8 slides that will summarize the essence of our healthcare delivery system as it exists. Then we'll go over a concise listing of myths and lies about single-payer health plan. We have an Ohio Senate Bill 91. It's sponsored by Senators Skindell and Tavares that was introduced in March. If that is not successful, the Healthcare for All, that is our single-payer action network, will develop petitions to go to the citizens to achieve a Medicare for All program in Ohio. There is a U.S. House Bill 676 introduced by Representative Conyers. It is waiting for voting, and hopefully that might work out. But again, I just want to repeat, the importance for us is promoting and sponsoring healthcare legislation is that it will call attention to the role of the corporations. Likewise, we can do that with our gerrymandering. And when I collect petitions on gerrymandering, I tell people about the corporate thing. And I think we need repetition. So, I'd like to show the next 8 slides, and then I want to go over with you some pros and cons about single payer, and then we can have discussion. Okay? We have the first slide. And as it shows, and like many problems, problems are complex. We have social and economic factors in the matter of education that interferes with whether individuals are going to be able to get their health care. If they don't have education, many of them don't know how to do it. Employment, as it is now, health care is associated with employment for the most part. And obviously income, family and support, social support, and community safety. So it's not just a simple single factor. And notice that the delivery access to care is 10% of the problem. We have the next slide, please. Yeah, this is a devastating figure. The healthcare cost per capita. There's the United States, $8,700. Germany, Canada, France, United Kingdom, half or even more. And then other countries, less developed countries, 3,480. We're double, and the main reason for that, of course, is the presence of the insurance companies. And the next slide will show us. Yeah. federal budget cuts in 2015. Notice healthcare is in the area of 28% of the budget. And Social Security, like that, I don't see the figure anymore. And defense there is in the range of 15 or 18%. And here is a major reason why we got the tremendous cost of healthcare is administrative expense. In the United States, it runs 30%. In Taiwan, which really, believe it or not, is a developed nation, 1.5%. Medicare is only has an overhead of around 3%, at most 5%, and here we're paying 30%. That's the major, major problem. Next slide, please.
Dick, we might let people know the first block up here says debt, and the next one down that's white says national defense.
Okay, yeah. How much
It
was
doesn't
it?
show up there.
Was it 18%? Was it national defense?
Yeah.
Yeah, 18%. And healthcare is 28% of our budget. Gigantic figure. Okay. Family healthcare average cost. This is 2010. It went from $9,200 in 2014, $23,000. This is with under programs that are associated with employment. Gigantic change. Now, healthcare costs a percentage of gross domestic product. 18% is healthcare, and France, Germany, and what have you can see is actually either 2/3 or over half the amount that we're spending. And next slide, please. And this is a gigantic look at this. In 2017, we're in the range of about $3.5 trillion, and by 2023, according to this, will be up to $5 trillion. Gigantic cost model. I think that may be the last slide. Here, this is a terrifying figure. 62% of bankruptcies are associated with medical bills. 62%.
Unconscionable.
I know.
Unconscionable.
I know, I agree. And 22% associated with job loss, and the remainder are just minor fractions. I think that covers the slides that I want to cover. Now, I'd like to, you have the handouts. I'd like to go over with you some myths and lies about single-payer health care. Let me sit down. Yeah. Okay. Okay. Single payer is a government-run healthcare. That would be true of the Veterans Administration. Oh, by the way, this is in the fourth page of the handout that I've given you. You can find this. We can do this together. This would be the Veterans Administration is a government-run healthcare, or the British health system, where the government pays for the doctors and the hospitals. Under single payer, you get a health care card, and you can go to any doctor or hospital in the United States. Doctors are not employees of the government. Hospitals remain in private hands. You get free choice of doctors in a hospital. Myth. Single payer will lead to rationing, like in Canada. Right now in the United States, the private health insurance company does the rationing, and it's based on income rather than need. If you don't have health insurance, you don't get health care. More than 30 million Americans currently lack health insurance. That's why 120 Americans die every day from lack of health care. There's some problems in the Canadian system, but most of what you hear about it are health insurance industry, is health insurance industry propaganda. And 0 people die every day in Canada due to lack of health insurance. Costs will skyrocket under single payer. Single payer is the only health care reform that will save enough money to insure everyone. By eliminating the health care industry, we save $500 billion a year or more in administrative costs and profits. We then use the money to insure those who lack insurance and then fully cover those who are underinsured. Yes, more people will be seeking health care because they will now have insurance. But they will be taking care of medical problems early, thus preventing many costly treatment later. That's one of the major improvements that having access to health care immediately is preventive medicine. It won't be just a matter of waiting until you get ill in order to get help. The drug industry would have you believe that there will be less research and development under a single-payer system. Much needed research most research currently is funded by the National Institutes of Health, done by the Health Insurance Agency. It's false. Yeah. Under single-payer, the research would grow. Drugs will be cheaper under single-payer. When all patients are under one system, the payer wields a lot of clout. For example, the VA gets a 40% discount on drugs because of its buying power. This single-payer buying power is the main reason why other countries' drug prices are lower than ours. Now you know why the drug industry is so opposed to single-payer. Single-payer will cover less than the insurance I have now. Wrong. For the majority of Americans, single-payer will be a vast improvement. All medically necessary care would be funded through the single-payer system, including doctor visits, hospital care, prescriptions, mental health services, nursing home care, rehab, home care, eye care, and dental care. An enlightened single payer will also result in a sharp increase in public health funding to prevent disease. No more bills, no more deductibles, no more co-pays. Single payer will cost me more than I'm paying now for private health insurance. The vast majority of Americans will pay about the same, less than they're paying now. The same or less. Instead of paying premiums to a private health insurance company, most of us will pay a similar or smaller amount in taxes. So right now, if you're paying $8,000 premiums for a family of 4 with a $4,000 deductible, your yearly liability is $12,000. You will probably pay less than that in taxes to fund a universal single-payer health plan. There will be no deductibles, and you can go to see any doctor or check into any hospital in the United States. That's what I wanted to say about this program. And I welcome any questions or discussion.
So one of the chief arguments against it is what's going to happen to all of those workers and all of that industry that has been this 30% of overhead. What's going to happen to all of those people? I happen to know that the SPAN legislation has a plan for that, but I'd like you to say so.
That's a very good question. Actually, the plan is that these workers that are that are now working in the field will be covered for a period of about 2 or 3 years. That they will find either payment or work for them. So they are taking that into consideration. It is a dislocation, but it is in the plans to take care of them for at least 2 years, my understanding. And
there's transitional retraining and
yeah, all of that. All of that will be included.
It's a very well-designed piece of legislation that was admired and approved by the bipartisan Ohio office that examines legislation. So it's a gem.
Absolutely. Any other comments, questions?
Wait a second.
Okay, remember the rules. You have to have the mic before you can talk.
Open your eyes or I'll talk to you.
Thank you very much for your presentation. The concern that I have about single-payer system is if everybody's treated equally and somebody who has economic means to buy up their care, they don't want to wait as long as somebody else, or they want extra tests, etc. How are we going to prevent this from ultimately becoming there's single payer for everybody, but those who have better health care coverage or more quickly responding health care? I'm very concerned that single payers can end up with the people who are the have-nots having basic medical care and they're pushed to the back, while the people who have money are getting their treatment first? And then also quality of the care, would there be a bifurcation of the care for the people who have not versus the people who do have plenty?
Well, that's what you're describing is that finances determines your access to care. And the whole idea of single payer is that it's going to be available to everyone. And the matter, I'm not quite clear what you're driving at.
Dee, maybe you can help with that.
Some people can always, when they have the money, can always get something more so than everyone else. Under the single payer healthcare plan, access to medical care should be equal. Now, a lot's going to depend on that. Some doctors will refuse maybe to take care of poor people. There's nothing that you can do about that. But at least the healthcare system will try to minimize the inequities that you're talking about. It isn't going to solve every problem, but it's going to solve it. And in fact, we know this from experience in other countries. It's a very legitimate question that you're making.
I just want to introduce myself. I'm with Dick. My name is Dee Chavez, and I'm the coordinator for Southwest Ohio SPAN, Ohio. SPAN is Single Payer Action Network for Ohio. I would like to add a little bit to that and also have a few more words to say, but we can take questions too. Right now, we have the kind of system you're talking about. The wealthy people or the people that have a good job are getting care. They get what they need. Some of them have to pay a lot in deductibles and copays, but they can usually manage that. Not always. With single payer, everybody gets basic, decent medical care. Now, there are some countries where they also have some insurance companies that people can pay a premium for that'll cover other things that, like maybe, cosmetic surgery and that kind of thing. But what we need is everybody gets care. Everybody gets basic health care. If you need an MRI or a CAT scan, you get it. If you want to have, 2 more tests down the road, I don't know. It's a doctor-patient decision. It's not necessarily just the patient can go in and say, I want this, but you can talk to your doctor about it, and it's a mutual decision for tests. Yeah, without the insurance companies involved. So, we think it would be a very fair system. It may not be perfect, but it would be much more fair than what we have now.
Does that mean that, does that mean that wealthier people can buy supplemental, or does this law prohibit buying something to supplement?
This law doesn't address that. This law is just This law doesn't address that. The law that SPAN Ohio has proposed does not address that. And I don't believe HR 676 addresses that either. That's the federal law that's been introduced by John Conyers many times and never acted on. So, that's something to be determined. But what we're addressing is everybody gets basic health care. They get what they need. They don't get facelifts and stuff like that, but they get what they need for their health.
I lived in England for a long time, and you do still have a two-tier system there, just as you have, class divisions. So that there are Harley Street private doctors that the people with money use, and then there's health care for everybody else. So why wouldn't that happen here?
I would like to add, because I go up to Canada every summer, and I'd like to speak on the fact that I needed to visit a doctor in Canada 2 summers ago, and I went to the equivalent of urgent care. They call it a walk-in clinic, and the practice is that doctors take a rotation. It's not a separate office. That's a for-profit place like we have here. It's a rotation among the doctors in the doctor's building who take turns. The lady who was a receptionist was extremely apologetic. but she said, we can't take your insurance and we don't take credit cards because we don't charge our patients anything, and so we're not equipped for it. You're gonna have to pay cash. I looked at my husband, I said, gee, how much cash do we have on us? Turns out it cost me $30. And I got a complete workup from the doctor. I was absolutely amazed. I got a prescription, which I took next door to fill. It cost me $12.50, $10 for filling the prescription, and $2.50 for the medication itself. It's a standard $10 for the cost of the prescription. Since I learned that time, I now take my prescriptions up to Canada and I get everything filled there. And it's really bad that we can pay without any insurance up in Canada less than we can pay for it with our Part D insurance here in Cincinnati. And I needed to fill a prescription here in last December, and I literally drove to Windsor to fill it. I saw a doctor, cost me $50. I got an entire year's prescription for $80. And here, they were going to give me a 1-month prescription. It was over $300. And I said, I'm driving to Canada. People do it all the time. Now, as for doctors not seeing patients, two-tier or anything else, this is our experience with our friends who live up there. We lived there for 5 years. Doctors have to accept every patient unless the doctor decides to opt out of the entire system. And doctors do not choose to opt out of the entire system because everything is covered by the system. I close with the last story about drugs. When I went back from where we were to Toronto, and a friend asked us, a Canadian, could I just pick up her prescription at the pharmacy for her? So I went in to pick up her prescription, and the pharmacy hands me the package and says, 61, and I pull out my credit card. And he looks at me and he says, for 61 cents? I never heard the word cents. I kid you not. It never dawned on me that at 61, I take out my credit card. That's my story. And when people tell you they ration health care, if you need it immediately, you get it. Okay, and I'm going to start with that. One story about our friend, the same one with the prescription. Okay, she needed knee surgery, right? And the doctor said, you have to wait till it's really, really necessary. Okay, it must have been January, a couple of years ago. He said, it's time to do it. She got on the telephone. I think it must have been March, because they said she was going to have to wait until June for the surgery. And she was terribly upset. Not because she was in pain, not because it would have been that much worse in June as opposed to March, but because she goes up to her cottage in June. And if she goes up to the cottage in June, she won't get her physical therapy and she'd have to stay in town for 6 weeks. So she went on the will call list if somebody has a cancellation, and she had it in April and she was thrilled. But again, you talk about going to doctors here. You can't call and get a specialist appointment here. You can't decide next week you're going to have surgery. If you need it, you go to the emergency room and it happens right away. Otherwise, you make an appointment with your doctor, and the doctor schedules it a couple months from now. Let's be realistic about how long we wait in the United States for what's called elective surgery. Thank you.
I have a question about, is SPAN a movement within the state, or is this part of a movement to do federal?
I'm glad you asked, because I was going to address that. SPAN Ohio is a state organization. We've been active for 16 or 17 years. I've been in SPAN for 10 or 12 years. And we try, I won't give you all the history. We tried to do a petition process, but we didn't have enough people to get enough signatures. Now we have been lobbying our state legislators, and we are bipartisan, but it's difficult because, as you know, our legislature is highly on one side, and they're not usually very sympathetic to our cause. But we're also planning, we have a plan we want to add to our database. We want to bring more people into the group and get more activists and go out and educate and get people to come and help us with doing events and things like that. And we are going to do another petition process, which will be to add a constitutional amendment to the Constitution of Ohio. That's how it has to be done now. We're going to start this, I think, in the next year, hopefully, if we have enough support to do it. So yeah, we're statewide. There are several states that are working on single payer, and some of them have gotten very close. California is pretty close. They passed, California passed it in the Senate, I think. Yeah, they still have to pass it in the other house. And New York's working on it. There's several states that have come very close. Actually,
Hawaii.
Nevada had a different plan. It was Medicaid for all, kind of a thing where you could buy into Medicaid, but the governor vetoed it, Republican governor. So.
It doesn't happen overnight. It took 50 years before Canada got that.
I was there in 1975, 71 to 75. I was there from 1971 to 1976, and I was covered by the Ohio, what's called Ontario Health Insurance Plan, OHIP. And I have to say, I had 2 children born in Canada. The first because I was living there, and the second because my husband got a job here in Cincinnati, and we moved down in July and discovered that my baby would not be covered because that pregnancy was a pre-existing condition. And we went back to Canada. Our daughter was born in Canada, so we have 2 dual citizens, but we went up there, and I can't remember, it cost me $48 or something else like that, right, because I insisted on a single room instead of
My wife and I spent 6 weeks in Canada on 2 occasions, and everywhere that I went, I would stop and ask ordinary people, how do you like your healthcare system? We never heard from one single person that had anything other than the fact that they have to wait. So what? Absolutely. The other thing is that in Canada, the specialists, the physicians were very much opposed to it initially. It took them a number of years, and the specialists are still holding out, but the ordinary young practitioners are very happy with this system.
Oh, just a couple of comments. The specialists here, if I have to go to a specialist, it's you have to wait 2 months to see a specialist. So it's one point. Then the Canada thing, I remember I had the same thing happen to me in Canada, and I went to the local clinic. They never charged me, and then they gave me the antibiotics. I don't even remember paying it. Probably was $10 or whatever. This was a while ago. But then the only thing I have to say is on the way back home, I had to go through a toll booth, but I had the toll booth didn't take credit cards or anything. So I said, screw it, I'm going through the toll booth. So that cost me $75 to pay the fine. So that was my biggest expense, was the toll booth.
Hi, you gave a really good presentation. I'm actually a medical student. I'll hopefully be a doctor in December if I play my cards right. And I just wanted to add a few comments to your very good presentation. I work with doctors a lot since I'm going to become one. And yeah, specialists are generally, you would be surprised how concerned doctors are about money and how much they're making when they make like at least $100,000 a year by default. But there's another issue with the single payer system that I thought about bringing up, and that's with student loans. I remember looking to see if I could do a residency in another country, and one thing a lot of the sites told me was that a lot of medical students from America don't go to other countries for residency because they pay less and they have more debt. Right now, I have over $200,000 in debt. It'll hopefully get more in residency, which is generally like 1 to 7 years, depending. You will only make around $55,000 a year because they pay us less than minimum wage. And the thing about it is, one reason why doctors' salaries are so high in this country is because we have like so much debt to deal with. That's why all the federal loan forgiveness programs are so popular. And so my recommendation would be, if you're going to get more doctors on board with single payer, you're going to have to find a way to reduce the amount of debt, because doctors on single payer systems do make less money, but then again, doctors in other countries don't have to pay money to become doctors. Thank you.
Donna, did you want to say something?
Yeah, I just want my husband retired in January. We wouldn't have any insurance, but we went on the Affordable Health Care Act. But we have Molina of Ohio, and it's really not working well for me. I didn't pay anything for any of my diabetes medicine. They made me change the brand of insulin that I use, first of all, and then I have to pay $55 for a month. I didn't pay anything before, and both of us are now on Social Security, but we're not Medicare age yet. We will be in a couple of months. What was your previous? Nothing. I paid nothing under his insurance for where I work.
Hi, I had a question about these commercials we're seeing on this new issue in Ohio about controlling the cost of drugs and the deceptive new issue. And then I tried to look up online to get some clarity, and I couldn't. So why are all these nurses and doctors and other people, nurses you wouldn't think, what would be their reason for opposing this new thing? Does anybody know anything about that?
Actually, we're going to have David Little come talk about that. I believe he's scheduled in October. That's as soon as I could get him in. But there's also information back here. I don't know if there are many copies left, but I will bring more next time so that everybody can get one if they want. Basically, it's attacking the pharmaceutical companies. So anybody can say they're a nurse, right? On TV, if they get paid enough. So just don't believe everything you see in the media.
People do. Let her give us some clarity on it. Is it good or bad?
I'm going to give this to Janet.
Could you answer her question about clarity? Yeah. That would be helpful.
On that drug issue, I honestly do not know. I have to research that.
Hi everyone, I'm Dr. Janet Everhard. You've seen me several times here at this venue. How many of you have Medicare? How many of you like Medicare? Yeah. And if you have Medicare Advantage, you get to choose, don't you? You choose, if you need a hearing aid, you choose that plan. If you need drugs, you choose that plan. If you need portability to go around the country, you choose that plan. You have great choice. How much does it cost you? No, it costs you. It's taken out of your Social Security payment, isn't it? And it costs with your supplemental plan, costs about $200 a month. So it is not free, and don't think that it's free. Medicine, your medical care costs a lot of money. We have a huge system that's fragmented and extremely expensive compared to other countries. And Medicare covers it quite well. And as you can see, everyone who's on it likes it. We have a popular system, it works. Why can't it be for everybody? In fact, it can. And the way to do it is surprisingly simple. I've spoken with the health policy experts at Xavier University and said, am I naive thinking that there can be Medicare for all? And I said, no, not at all. But there needs to be an incremental movement to Medicare. And the way we do it, you choose. And I said, well, let me run this by you. What if we take the highest subsidized subset of the ACA, the ones that are costing the 1% of the 1% the most, and we move that highest subsidized subset to Medicare with their subsidy, and every year we do that in whatever way the experts tell us is the right way to do it. Then we uncouple health insurance from small business. They are strangled by having to cover their employees' insurance. Just strangle. It's why they don't hire more people. That's why they keep everybody at 30 hours a week. That's why everyone is at part-time job, juggling part-time jobs, because the small and some medium employers cannot afford to cover healthcare, let's uncouple it. Why is it even in the healthcare, in the business arena? So then we offer them Medicare. And at that point, we have a large portion of our population on Medicare. At that point, that's when we negotiate with Big Pharma, with device manufacturers, with accountable care organizations, with physician groups and hospitals. Our healthcare is going to continue to be administered by the private sector, and that's a good thing. We do not want to be the VA. We do not want our physicians to be government employees. We do not want our hospitals to be owned by the government. We want the competition and the choice and all of that offers us. But they certainly can become less fragmented. So are there ways for us to incrementally move to Medicare for all? And I suggest we need to start that process. Thank you very much.
Any other questions?
Yeah, you were asking about clarifying the Ohio issue involved with limiting the amount of money Ohio pays to drugs to what the Veteran Administration pays. A tiny bit of background is the Veteran Administration typically gets a 40% discount on drugs. And this law, if it is approved on the ballot, would say that Ohio, state of Ohio programs can't pay more than the VA pays. And you're saying, well, what are the arguments against it? The arguments against it are always extremely vague. The argument for it's very specific. The drug companies will sell drugs to the VA for 40% less. They don't blow off the VA, so why would they blow off Ohio if Ohio says we're not paying more than that? Are they going to not sell drugs to Ohio? Well, the argument is that there's this vague argument, oh, well, the drug companies may refuse to sell to Ohio because they're not paying enough. But as my father and other people have pointed out, drug costs have skyrocketed. There's plenty of money involved in selling drugs that a 40% discount, it's unimaginable that any drug company would refuse Ohio's business because they're paying more than VA. That is the argument. They're just saying, well, what if they did that? It doesn't make any sense, but that's it. And the way to find out more, to get a little more clarity, is to go to Ballotpedia on the web. B-A-L-L-O-T, Ballotpedia, and there is some discussion of this issue, I think.
See, I'm trying to understand why can I buy it in Canada with no insurance whatsoever? I just give my credit card and pay the entire amount, and I can buy it for less in Canada with no insurance than I can pay for it here with my insurance. That's what's wrong. Somebody here is making a lot of money out there.
Real quickly, my husband and I are planning to move to Thailand as soon as we can get our house ready and sell it. Unless I can talk him into doing the RV first. Anyway, one of the reasons we're moving there is because it's so much less expensive to live there. And they have great medical care. I have a dog that needs an MRI, $3,000 for a dog, okay? We looked it up out of curiosity to see how much they charge for an MRI for a person in Thailand, $300 tops. Is that incredible or what? I mean, it's crazy that our country can't do for our people what everybody else is doing for theirs. Even Cuba has a better health system, for Pete's sake.
It's a great place for plastic surgery, too.
Is it? I'll look into that. Make your bracelets?
I would like to say that we really want to draw people into SPAN Ohio, so if you're interested, please sign your name back there on the notebook that I have out, or sign a letter to your legislator, and we need your email and your address. We don't have to have your phone number, but that's nice. And we'll put you on our database, and you can come to our meetings. We have a monthly meeting on the 4th Wednesday of the month. It's here in Cincinnati, but we cover 8 counties, and we're trying to spread out to more counties. We have a really intellectually stimulating group. A lot of doctors and other health professionals. I'm a nurse myself. I've been a nurse for 45 years. And, but lots of other, we have, people in business and other areas represented. And it's an interesting group, and we have a lot of fun together, but we do a lot of outreach and education. So please come and think about joining us and helping us out with our cause. If anybody's not convinced about single payer, I would love to talk to you. It's the 28th at 7 o'clock, and it's the First Unitarian Church on Linton and Reading down Clifton. And if you get on our database, you'll get an email about it. And we do movie showings. We have movies that are very compelling to educate people. We do talks like this, and we go to fairs and all the town halls and stuff like that are going on. There's a lot of that right now. So anyway, thanks a lot, and love to talk to any of you that are interested and come. And if you want to be an activist, that's wonderful, because that's what we need, is people that'll help us with what we're doing. But if you don't, that's fine too. Just you'll get our emails and information.
And I can say from experience, they are wonderful people to work with. I was involved with SPAN for several years there, and then I got distracted by presidential elections. So, but they're great people to work with. They're so dedicated. I don't know how many days we stood out in the hot sun at Traders World getting signatures on petitions. And it just really is a worthwhile cause. I highly recommend you get involved with it if you have the time.
And it is a great antidote to the anger that most of us feel about Trump and all the Republicans right now. You feel like you're doing something positive.
Right. Does anybody else have anything to say? Could I introduce Mike real fast? This is Mr. Bozian's other half. Just stand up first, Mike. Please, just stand up. Stand up. How long have you lived with Dick?
Oh, Jesus. How long, Richard? 1951.
That's where I was born.
I know, and now 66 years.
Mike,
It's been a hard road.
how did you two meet?
I know. Over a bedpan.
Mike is a nurse.
You can tell the story.
I'm sorry.
I just have a question about what kind of nutrition tips do you have for us that you live so long?
What kind of nutrition tips do you have since you've lived such a long life?
I think there is no such thing as a perfect diet that would suit everybody, because people are so different. But the nearest thing to an ideal diet is probably the Mediterranean diet, if you're familiar with it. That's the closest thing, because it includes whole grains, legumes, nuts, and fruits and vegetables and what have you. That's the nearest thing. There is no perfect diet for everyone, because you got people that have problems with gluten, you got people with diabetes, and so forth. But the Mediterranean diet approaches it very well. I practiced that more or less over these many years.
He exercises every day, and he drinks a low-sodium V8 every morning, since he's told me to get all my nutrition out of the way. Low-sodium V8 every morning. I noticed after my dad got to be about 90 or 95, he used to annoy people with his nutritional stories, but now whenever he says something he does, everybody starts writing it down.
Is Eddie Kamrazaka here? Okay, we have a voter registration form. I'd like to thank Dick. It's been enlightening for all of us. There's so much that we all, once again, every week we are learning. And no matter how great we think this country is, we can be a whole lot greater. So thank you all so very much, and hopefully we'll see you all next week.